Queue Monitor WQM, Antoinette Stein, Pfeiffer University, Certificate in Healthcare Management Capstone Project, July 5th, 2020. In this presentation, we will explore a Queue Monitor project implemented by a North Carolina healthcare organization. During the last few months, I had the privilege of being part of Phase 20 of this project. WQM is a type of document management system. I will present the scope of the project, new and old documentation management processes, reasons why WQM should be implemented, the implementation process, the steps completed in Phase 20, barriers noted, government mandates, security, and the other experience other organizations have had with WQM. Other organizations have implemented WQM. During a panel discussion at a 2015 Cerner Health Conference, it was noted to be a successful project by current WQM team members at Stony Brook Medicine, New York Methodist, and Torrance, California. They all reported having had a positive experience with WQM. The purpose of the WQM project is to save money by reducing the need for expensive paper and toner. It allows for more privacy, security, and it improves the process of sharing patient information by making it faster and more efficient. It is anticipated that a large portion of this organization's clinics will have WQM available to use. The project team is currently in Phase 20. Phase 21 will address and encompass all incomplete work from Phase 20. A total of approximately 400 ambulatory clinics have implemented WQM successfully. Current processes require fax to paper to scan workflows, creating unnecessary steps in document management. Utilizing WQM software will allow Corporate Health Information Management, or HIM, to electronically manage many aspects of medical record functions at multiple locations. This will improve accuracy, safety, and efficiency while driving down the cost of paper and labor to manage paper stacks. The organization's old paper medical record process included creating a paper copy of the document. The document was then sent to the decentralized HIM department through interoffice mail, faxed, or dropped off. This would take a few days. Then the decentralized HIM would process the document to the electronic health record the day after it was received. The new process sends the paper document directly to corporate HIM from Xerox to the electronic health record, or EHR, and is available to you by the end of the day. The paper documents are then shredded. The release of information department's old process included sending information to the decentralized HIM department through interoffice mail, faxed, or dropped off. The decentralized HIM department would then scan through WQM to corporate HIM. Corporate HIM then uploads the release authorization to the EHR. Finally, corporate HIM releases records to the requester. The new process for release of information includes information is sent to corporate HIM by scanning in real time. Then corporate HIM releases authorization to the EHR. Finally, corporate HIM releases records to the requester. Papers are then shredded. This is an illustration of what the Xerox machine screen will look like. A team member selects the icon on the home screen to either scan medical records or the release of information requests. Next, documentation is scanned through to automatically post it in WQM for HIM to process the right patient, encounter, and document type. Then, scanned paper records are sent to HIM for quality review and shredding. These are a few specific reasons why it made sense to implement WQM at this organization. 1, it's more efficient to manage documentation by electronically sending it to the provider's message center rather than through paper. 2, it's more efficient to manage corporate HIM surgical documentation and release of information requests electronically instead of paper, and integrating management software to easily see where documentation is across electronic queues versus stacks of papers on individuals' desks. 3, it's easier to manage and meet regulatory guidelines on release of information turnaround times. 4, assist with increasing HIPAA privacy risks by providing individual electronic work queues for subject matter experts. 5, it will give team members the ability to capture emails to increase support and processing of transitions of care requirements. And 6, reduced supplies and labor costs required to manage paper documentation. The realized decreased labor costs will be reallocated to other workflow and processes. The process to implement Phase 20 consisted of identifying the practices that would implement WQM. Next, a budget is created based on the number of practices needing the upgrade. Then, a team was created to gather information to confirm if the practices have the sufficient equipment needed. A Gantt chart is a tool used to keep track of deadlines needed to be met on the timeline, and everyone on the team has their role identified. A cutover time is scheduled at 5 p.m. the day before quote-unquote go live. The go live date starts at 8 a.m. the day after the cutover. Lastly, a daily phone meeting, or issues calls, twice a day is conducted for a week to discuss issues that need attention. This is an illustration of a sample Gantt chart. A Gantt chart is a horizontal bar chart which allows you to see a project work plan in future time. Some display the current status in addition to the responsible individual assigned per task. The Health Insurance Portability and Accountability Act, or HIPAA, was signed into law in August 1996 and was updated by the HIPAA Privacy Rule in 2003 and the HIPAA Security Rule in 2005. Title II of HIPAA is concerned with administrative specifications, client privacy protection, and security regulations for healthcare documents and other protected health information, or PHI. Health information technology for economic and clinical health, or high-tech, was thought to give the healthcare organization incentives to make the changeover from paper to electronic records. The goal was for high-tech to reinforce the HIPAA privacy and security rules. The HIPAA security rule establishes national standards to protect individuals' electronic personal health information that is created, received, used, or maintained by a covered entity. The security rule requires appropriate administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of electronic protected health information. You might ask, is patient information more secure? Paper records may become misplaced or damaged due to environmental occurrences, such as flooding or fires. On the other hand, electronic documents create a heightened level of security of patients' information because of the ability to store data or documents in multiple places. A document management system allows for another layer of protection. Organizations may create additional protections by omitting access to certain areas of documentation for certain jobs. For example, nurses may not need to access a patient's insurance information, and the front desk team member does not need access to patients' lab records. Another security feature is employee names and timestamps are automatically assigned at every stage of processing. One barrier that occurred was if the practice wasn't owned by the organization, they typically do not have a compatible phone line to use. One of the medical practices in Phase 20 wasn't owned by the organization, and we were not able to port over that number. Therefore, a new number had to be created. While this is a good workaround, the downside is all of that practice's marketing tools and name tags had to be updated. Another barrier is Xerox machines are usually not bought outright. They are usually leased. The practice may have a model that is not compatible. Also, sometimes during after hours, Technicians do not have access into the clinic. In these cases, a task request is sent out to the badge team. The project was successful and it met all of the required measures, such as reducing supply, labor costs, and less scanning. It ended 6 months ahead of schedule and below budget.